Just like a surgeon would need the right scalpel, the right tools, or the right sutures, we need to evaluate the right digital health technology, match them with the right healthcare system to achieve the best goals to improve patient quality and outcomes for everyone. My name is Maulik P. I'm with DatosX Digital Health Labs, DHL. I serve as the Chief Health Innovation Officer, and DatosX is a research corporation that helps validate digital health technologies for everyone. A validation platform is necessary in today's market for many reasons. One is, serving previously as Chief Health Information Officer, I always wanted to know what the value of a technology was before we purchased it. In today's world, health system dollars are at a premium for many reasons, and becoming even more premium. And having a tool that validates the technology, the ROI, the functionality, the integration, evaluates for the health system the value add of any technology that they're going to use. Second, for the company or the organization itself, or for the vendor partner, the value is that they can get FDA approval, validate the clinical or operational function that they serve, and achieve a higher level of functionality than they would otherwise. So going back a couple of years, we were working with a company that was an AI software company that was evaluating risk of mortality for our patients on the inpatient side. This was a critical need at the time because we wanted to divert palliative care resources to patients that needed them the most. And palliative care resources are a premium resource for a health system. The question was, who needs them the most, and how do we risk stratify our patients to get there? We partnered with an organization that allowed us to do this, and they were a fantastic organization. When we started working with them though, the way they integrated their algorithm into our database with the EMR allowed us to get a certain level of threshold of quality and sensitivity and specificity. However, it's not fully satisfactory, and the reason is because they were using a previous data set and not our specific data set. With some work with them, we were able to refine that and actually achieve a very satisfactory and very good threshold of quality for us. But it took a few months to get there. Now, if I would have had DatosX at that time, we probably could have achieved that within 1 month instead of 6 to 9 months that it took us. And that may not seem like a big difference, but in terms of patient care, months is a big timeline. DatosX serves needs for multiple organizations. One is on the health system side, partnering with them to allow them to see what tools are best and most efficient for them with the best ROI. And that return of investment may not just be financial, it could be operational, it could be better clinical quality outcomes, etc. But knowing the research ahead of time allows you to make a better educated guess as to what tools will be most useful for you, because health systems have finite resources and they have to be expeditious in what resources they use and where they use them. So DatosX can help guide that strategy better with data. For the industry partnerships, we help them understand what their product is, refine their product, improve their product, perform research, medical grade research level quality on what they do to help understand the extent of their products, and allows them to achieve FDA approval status or a better product that achieves the goals for a health system much faster and a much more efficient way. What I'm excited about DatosX is an environment that's becoming increasingly more difficult. We'll provide real-time data on the value of a product, and we're able to match the product and the health system in the most meaningful way to create the best marriage and long-lasting outcome for both sides. We work with the vendor partnerships in the industry. We work with the health systems that need partnerships. We also work with private equity groups and venture capital funding. And all that put together puts us in a unique position that allows us to work across all spectrums, connect them together to achieve a better partnership, better clinical outcomes, better operational efficiency, and better strategies for health systems and industry partners alike. So as a physician, I care about patient care. At the end of the day, that's why we're in healthcare, to create better patient care. When I started out as a physician, I realized that one individual within a system can make only so much difference. As I changed my career path from being a purely frontline physician to being in the C-suite of health systems, I realized that we have to make a dramatic change in the actual healthcare system itself to improve patient care and quality outcomes. To do that, IT and digital infrastructure are a big component of that in today's world. However, within the digital infrastructure space, knowing which are the right tools is very important, and knowing which partnerships are the right ones are very important. Just like a surgeon would need the right scalpel, the right tools, or the right sutures, we need to evaluate the right digital health technology, match them with the right healthcare system to achieve the best goals to improve patient quality and outcomes for everyone.